Hello, everybody. This is Analytical Survival, and welcome to interview number 1 in a 2-part series with noted guest and flight medic Emmett Spraktes. Today, we'll be talking to Emmett about emergency medicine and particularly how it relates to approaches to treatment, medical gear, and mindset. Emmett is the author of his recently released book entitled Selfish Prayer. It is an account of the events leading up to the fateful firefight where he distinguished himself in combat. For these actions and more, Emmett was awarded the Silver Star for his extraordinary heroism in combat. His fascinating book is available for purchase on Amazon, and I'll leave a link in the description box. Emmett is also a retired California Highway Patrol officer, and he is currently involved as a faculty member of Team 3 Tactical Training. Today he's going to share some of his wisdom with the audience and some practical ways that we can all become better in the art of emergency medicine. Emmett, it is a true honor to have you on the Analytical Survival channel.
Thank you so much. What a wonderful introduction. I really appreciate that. And I'm just so pleased to be here, to be able to talk with you and your listeners. And in the fact that you are asking me some of these questions based on my experience tells me that you are truly giving and reaching out to those people that you think have some experiences that you can share. And I appreciate that. It's always good. You're instructing people and you're bringing people in, and that is the way to really impart information. I think it's wonderful.
Oh, awesome. We try to be as analytical as possible here. And, first off, congratulations on your new book. It's an incredible story for sure. And we'll get back to the book in more detail in interview 2. But for now, in this interview, let's talk a little bit more about your initial journey into emergency medicine. I was wondering if you could share with our listeners what exactly were the things that first got you interested in trauma care?
Well, it's funny. I had absolutely no interest, zero interest in getting into trauma or medical care at all. My interest was in law enforcement. Well, in California, one of the required courses among many courses is first aid and CPR, cardiopulmonary resuscitation, with a tactical part to it because law enforcement is inherently dangerous. So that was really my first introduction into trauma care or any type of emergency medicine. Now, I've worked with several different agencies. When I went to the California Highway Patrol, at the time, every cadet that went through was required to become an emergency medical technician, and that's 120 hours of training. And so, although I didn't have to go through that because we were a part of a merger, I chose to because I felt like I could better take care of the public at large. It was my duty. Along with discharging other duties, we saw a lot of accidents. We saw a lot of injuries. We saw a lot of sick people. And I felt that I would be better prepared if I had the emergency medical technician course. And that was the point where I really kind of got the bug that, I wanted to be able to do more. I mean, I had children. You learn these skills, and often you use them at home. And so I remember that there was a point when I was on the SWAT team that we had a full-time paramedic on the team, and that's like 1,000 hours of training. Well, he had to move on, and so we went. Our SWAT team for the California Highway Patrol went without a paramedic for some time. And they asked for volunteers, and I thought, well, there were several other people that I thought were much better qualified based on their, past experiences. Well, no one wanted to do it, and I thought, well, how hard could it be? Man, I don't know what to tell you. It was, I don't know what I was thinking. I mean, I was grateful to do it and blessed to be able to. And after that, I really took it on and graduated and had a lot of experiences and became the tactical paramedic for the Highway Patrol. But it wasn't something that I sought out, like when I was a kid and somebody fell over, I really wanted to take care of them. I didn't have that. It developed by necessity, and I found that I was really able to help other people here.
That's fascinating, how you segued into medicine from someplace sort of related but unrelated. For those of us who are not familiar with what a flight medic does, I was wondering if you could tell the audience just what are your duties and responsibilities, and particularly how they differ from a combat medic on the ground?
I worked in two different systems as a flight medic. One for the California Highway Patrol, I was a flight observer medic, and then one for the California National Guard as a flight medic. Although similar, they had different aspects were a little bit different. Now, I also worked as a ground medic or paramedic for the Highway Patrol, and as a ground medic when I went to Iraq. Again, similar but different. But let me tell you about flight medicine. It's really difficult in that it's sensory deprivation, patient assessment, and treatment. You're asking yourself, what the heck are you talking about, Emmett? The thing is about aviation and helicopters is they're loud. They vibrate. You fly at night. So you can't really see, hear, or feel when you're doing the patient assessment. And you have to deal with factors like cold, again, the vibration. You can't communicate to your patient. It makes it extremely difficult. And, of course, sometimes when the scenario gets a little aggressive, say in combat, you're banking left or banking right, and so your center of gravity gets thrown off a little bit when you're doing these procedures. Also, of course, you're dealing with altitude, which when people are injured or sick, they can easily become hypoxic, again, the hypothermic, and now you're dealing with different levels when you're going up to altitude. So there's a huge difference there. Now, I can say that on the ground medic piece for the military, there's a lot of similarities in that you can be in the middle of battle and you can't really see, feel, or hear much. At least you're not getting yanked and banked too much unless you're in the back of a vehicle. They can be similar. In the law enforcement or civilian side of it, it found that as a flight medic in the Army, I got shot at a lot more than as a flight medic in the Highway Patrol. And so, in fact, I don't know if I ever got shot at in the Highway Patrol as a flight medic. But you just never know until it hits something, right? A big difference, of course, is that you're flying your ambulance around, so you have a lot more equipment, a lot more medicines. You're able to have a lot more with you. So you have a flying ambulance. As ground medics, especially if they're on an infantry unit for the military, they have to carry on their back what they are going to use to treat you. I hope that gives you enough of a variation or a contrasting what the differences are. Basically, when you have a helicopter, you can carry a lot more stuff, but a lot of the treatments are a lot more challenging based on your environment.
That's excellent. Excellent. Thank you so much for that. I was thinking that there could be a lot of listeners who are just getting introduced to emergency trauma care through the prepper movement especially. And if things ever got bad enough, and they very might well one day, find themselves face-to-face with a medical emergency. So I was wondering if you could share with us some important principles that you've learned in the field, especially concerning mindset and the priority of treatment.
Oh, I love that question. Because people that are not prepared when they're suddenly faced with an event and they have done no training and they have not put themselves in the mindset and they haven't thought out different scenarios, really struggle initially with what they're going to do. But let me tell you one of the concepts that I have really embraced, and this comes from Army Special Forces. This is the thing. First best treatment when you are under fire is superior firepower. That's the medical perspective from Special Forces. For law enforcement, their equivalent to that is the scene safe? And if the scene is not safe, make it safe. Both of these concepts mean that you don't become a victim. You are the rescuer. You need to stay the rescuer. So you have to really step back. Even if you're running forward, you have to determine that you're going to have a more global perspective on what's going on. Don't get focused onto one person necessarily. Take a look and step back and see what the scenario is. Just a couple quick examples. Car hits a pole. People are in the car. Obviously, somebody's bleeding in there, but it's a power pole and there's electrical wires bouncing around. We know that people will run to the car and get shocked, but what you really need to do is you need to step back, dial 911, and say, get that power cut off. Or if you can get that power cut off somehow yourself, do it. Don't become the victim. The mindset is that you're going to win. The priority of treatment is making sure that the scene is safe or that you have superior firepower. The other priorities, and I'm going to walk you down this a little bit, is on the military side of the house. Obviously, the tactical law enforcement side of the house is superior firepower. After that, it's going to be self-treatment. You get injured, you need to treat yourself. Get yourself into a place where you have cover, concealment, or both, right? And you treat yourself. Don't wait for somebody to come and fix you. If you can possibly fix yourself, do it. If you see somebody that's confused or doesn't have something and you can't get to them, call out to them, even on the radio. Call out to them and say, hey, look, you need to wrap that. You need to stop that bleeding. Set yourself up or you're going to be okay. Give them that psychological, you're going to be fine when you get to you. People go into shock when they think they're in bad shape. And even if they are, sometimes they don't go into shock when someone is talking to them because they're being told, hey, I'm going to take care of you. The mindset and priority of treatment, after that, you get over there and then you start working on them. I can tell you, make sure that you have a kind of a high visual horizon. You're looking around, you're making sure no one's sneaking up on you. And it's funny when you talk about the mindset and the priority, it's different in different systems. I know that for years it was ABCs. Well, now in the military, it's a little bit different. If you run up to somebody and they are bleeding out, they're profusely bleeding, and you could throw a quick tourniquet on them or a pressure bandage to stop the bleeding, that's what you do first, because we know now that you can replace air, you can breathe for them, but you can't replace the blood. Mm-hmm. So you stop the bleeding first, then you get the airway going, and then you move on. Now, let me just say that these concepts are very difficult to do and to really embrace unless you're really willing to immerse yourself in, say, doing some reading or taking some courses. It's really kind of tough. But I think the biggest thing that people can do here is to sit back and bounce it off one another. What would you do if this happened? Let's talk about it. I think that is the best type of mindset to have. And then they can determine, based on everything that they read and the courses that they take, their priority of treatment.
That's awesome. Those are incredible gems of knowledge that I know it's going to absolutely help our listeners. The next question will sort of piggyback on the previous one I just gave you, and it relates to training itself. I was wondering if you could possibly suggest some ways that a civilian can become better trained in trauma care. And I know that your personal military medical training has been quite extensive and excellent. But what sort of civilian trauma courses, in your professional opinion, are valuable for the everyday prepper?
Oh, I love that. Let me just say that, and this is based on years of experience, and that is really a basic first aid course. And you go, well, okay. But if you've never been in the system, if you've never taken anatomy or physiology or never had any courses, a basic course will get you some of the terminology, get you familiar with some overall concepts, what the materials, what the equipment, what the bandages, what all that looks like, and what to do at a basic level. After you take a basic first aid class, I think a CPR course is really extraordinarily valuable, CPR course. Because in that, they deal with reviving people, drowning victims, choking victims, adults, adolescents, and infants. I just know you do some hands-on in there. So people that kind of sit in the back of the class aren't allowed to sit in the back of the class. They actually have to go hands-on. So it kind of brings people out of that, their closet kind of, get them over there. So now you've got a first aid and CPR class. My third course that I would strongly recommend is maybe a little bit out of left field, but I got to tell you, I went to a junior college and took a wilderness medicine course, and it blew my hair back. Just the fact that you're out in the middle of nowhere, and you have to come up with ideas and ways and means of bandaging, splinting, surviving, was extremely valuable for me. It was like the MacGyver of wilderness medicine. You had to come up with ways to develop a splint or just from the materials you have. Now, you may find yourself at home, but if if a tornado came through, you're going to have to be able to find what you can find and treat yourself, treat your family. So I think, again, a basic first aid course, a CPR course and a wilderness medicine course at a junior college would be the way to go for a serious introduction. Now, the two resources that I would strongly recommend is go to the internet, because you can look and see how you do these techniques, and you can read about it and you can watch it. And the second resource, and one that I would take, one that I'd throw into my go to hell bag, would be the Special Operations Forces Medical Handbook, and that's like a 4x8 by 2-inch thick book. And it's designed to be wet and submersed in water and all that. But it tells you everything you need to know to survive so many medical and trauma treatments, and just how to survive, how to set up everything from latrine to veterinary medicine to, just extreme survival. And so that would be the resource that I would strongly recommend, along with the internet.
It's awesome advice, and I particularly like the wilderness medicine, where you're really forced to become a field expedient with a lot of the techniques there. This next question is a little bit more personal, because given your incredible story of being a first responder on the front line, I was wondering what, in your opinion, are and were the most challenging and rewarding aspects of your job?
Well, initially, when you get into field medicine or flight medicine, you are hesitant, just like anytime you start a brand new job. And so you really have to put yourself out there, but you have to do it. Somebody's life hangs in the balance oftentimes. Once you get into the system, you become more and more confident, you become more and more skilled, your knowledge base really grows. I think the challenge, once you've been into it for a while, is to stay sharp, to drive yourself to continue to train, to continue to take the courses, and to continue to challenge yourself. Because just like anything we do, for example, if we go to the range or if we're canning food or whatever, if you don't do it in a long time, it's all perishable skills, and you'll lose your edge. And the last thing you want to do is lose your edge, when someone's really needing you. The rewarding aspects of my job, I have been so blessed to be in this scenario many, many times where we've been able to save somebody's life, that they would have perished had we not been there. Just to be able to contribute that way to humanity is, and I say this a lot, is a blessing. I've been somehow put in that position. Yes, I've worked hard to get there, but I've been able to do it, and it's just so rewarding to bring people back from the edge. It's something that you can quietly be, proud of.
Oh, that's awesome. Awesome words, brother. Well, folks, that's all the time we have. I want to thank Emmett Spraktes for taking the time out of his incredibly busy schedule to be with us here. Folks, please make sure to stay tuned for part 2 of this interview series, where we'll delve right into Emmett's new book, Selfish Prayer. And folks, if you haven't already done so, you can purchase Selfish Prayer at Amazon.com. And again, I'll be putting the link in the description box as well. Once again, this is Analytical Survival saying, stay safe, my brothers and sisters.